Okay, so this is a young woman. She was like her early, mid-20s. Okay, here's the finding. So we're down the pelvis. She came in with like rectal pressure. Oh, my computer's being slow. Anyway, it basically was a cystic-y looking lesion behind the rectum. It was very big. It went down even into the ischial fossa. Any thoughts?
There's a differential for retrorectal or presacral cystic lesions that includes teratomas and tail gut cyst is a big one, and then there's a couple of other things as well as some of the usual enteric duplications and lymphoceles and stuff like that. But the big one, I think, that we see pretty frequently is tail gut cyst.
Yeah,
MRI is
exactly.
helpful in these.
Yeah. So whenever I get one of these, Google like graphics retrorectal cysts. There's a really good article about like the differential for that. But basically, the most common one is these congenital tail gut cysts. So you can see the anyway, it was very cysticky. So it wasn't like a solid mass. So the other thing you can think about in this area is like a gist arising from the rectum. You also always want to make sure it's not arising out of the sacrum, a teratoma, esophageal teratoma, or myelomeningocele. So we see here it's completely unrelated to the bone. So it's in this differential of lesion. And one of them, the most common one, is the tail gut cyst. And the tail gut cyst actually tend to be multiseptated, like for example. Whereas, and another one you can get in this region is an epidermoid cyst. Those can have restricted diffusion and tend to be more unilacular. It doesn't really matter. I would think that to differentiate between those two, they both have some malignant potential because they're lined with, cells that can have malignant degeneration. Most of them will be affected, but their malignant degeneration is small, and so you want to look for anything enhancing. But otherwise, the other thing that's tricky about resecting these, observing because they're often like really low down, and if you like violate the sphincters, then they'll be incompetent. But so
what
we
is
don't
it
know what this
from?
one is yet. What'd you say?
What structure is it arising from? Is it the mucosa?
It arises from like leftover neuroectodermal tissue that is dropped off in that space.
Gotcha.
So it can actually be, for example, they can be lined with different things. I pulled up an article, but anyway, be lined with all sorts of tissues. And some of them can be lined with like mucinous tissue. Those would have a higher rate of malignant degeneration, but you can't know until you resect it what it's lined with. So you're looking for any signs of malignancy, but otherwise say like we're going to resect it because over the lifetime, most of these present young. And so you don't want to just leave it for like 60 years and then eventually it'll have something, right? Anyways,